Hi y'all, my name is Courtney Lake and I am filming this video about my service learning experience for my health agency management course within my Master's of Public Health degree at Liberty University. So my service project experience was with Iora Health, whose patient population is majority Medicare patients who are over 65 and or are on disability. So when patients become elderly or disabled, there are so many issues that arise with their health care that are more acute than focusing on annual or preventative care. The World Health Organization reports that there are health inequalities seen in the older age because of many of their environments, opportunities, and behavior changes. And new public health policies need to be formed due to the fact that our population is growing and people are living longer. The project that I led was setting up a mobile mammogram clinic for the patients to have equal access to a necessary screening. Due to 1 in 8 women in the United States developing breast cancer, it's important that all women complete their annual screening mammogram as recommended by their medical provider, which is usually until at least 75 years of age. Breast cancer has multiple different treatment options available to patients, which is why it's very important to be screened each year. That way, if breast cancer is found, it can be found in the earlier stages, so that way the survival rate is higher. Throughout the past few months, when speaking to patients, many of our team members have noticed that many patients have not gotten their flu vaccine, bone density scans, mammograms, prostate checks, blood work, colon cancer screenings, annual eye or dental scans, and so on within the past year. So we realized that COVID-19 was not only taking lives, but also scaring people away from medical clinics due to possible exposure and illness. Because they were not being seen by healthcare professionals, many people's issues went unacknowledged. With this knowledge in mind, I did utilize my assessment and analytical skills I have learned throughout my degree to determine what was needed by our patients and how to make it most beneficial to them. An important aspect of public health is that if you are addressing a certain population, it needs to make sure it's pinpointed on covering their needs and it is specifically accessible to them. As I reflect on the project, I think one of the most important aspects of a collaborative team for a public health project is for all team members to have a passion for the current project they are working on. I believe a person cannot be a true good public health servant without caring for human beings and their health and well-being. This is not something that someone needs education or training on, but something that is inside of them that drives them to help those who face inequalities within the healthcare realm. Philippians 2:3-4 tells us, "Do nothing out of selfish ambition or vain conceit. Rather, in humility, value others above yourself, not looking to your own interest, but each of you to the interest of others." Because of this passion and our drive to understand what creates a healthy being, we understood that it is necessary not just to see your doctor regularly and take medications as prescribed, but also for our patients to understand that they should be screened for certain diseases and complete preventative measures so that way things may be able to be taken care of before they become a concern. I utilized my program planning skills to set up a timeline that would make sure the program was organized and happened as soon as possible to make sure many patients were screened in a timely manner. I had to use communication skills to reach out and find a local vendor to utilize for the mobile mammogram clinic and negotiate for a date, time, and price that worked for them and worked for us. I had to plan out marketing in time to make sure people knew about the program we were offering and had time to ask questions, speak about concerns, or schedule their time. We also had to communicate information to the patients and create a schedule for this mobile mammogram clinic. Throughout the planning phase, I realized that an important aspect of being a collaborative team is truly acknowledging other skills. So, for instance, as the leader of this program, I wanted to take on as much responsibility as I could, but realized that some of my team members had better qualities for certain tasks. So, some team members' education and background may make them better equipped to handle certain tasks better than myself. So, in that aspect, it took some acceptance from myself and other team members to realize this and take a step back to allow someone else to lead that part of the project because it will better serve the population we're trying to reach. Another aspect that is important for a collaborative service team is leadership. A leader knows the skills of those who are working with them, or at least they should, constantly striving towards the goal at hand, and to be understanding of the community that they are trying to serve. It's also important for the leader to be well respected by those who are assisting him or her, to work together towards one main goal. Like I said before, it's also important for that leader to direct certain tasks or goals to others on their team who can achieve it faster or better to help the ultimate cause. Even after everything I talk about, I feel that the most important thing about a collaborative team in public health is to make sure that their mission positively affects at least one person's life. My thought is that if just one person who is screened through our mobile mammogram clinic finds out that they have cancer and can start immediate treatment that has successful results, this whole project was worth it. That can also probably save family members down the line who now know firsthand the importance of being screened for preventative measures such as this. Thank you for listening to my discussion about the teamwork involved for my mobile mammogram clinic project, and my sources will be listed below in the discussion board.